Welcome to the University of California, San Francisco Department of Orthopaedic Surgery. My name is Benjamin Ma, the chair of the department. In this video, you'll find out more about the residency experience and also impact of our faculty, both nationally and also internationally. I welcome you to kind of look through the video, and if you have any further questions, please reach out to us. Thank you for your interest.
Hi, I'm Dr. Anthony Ding. I'm the Residency Program Director for Orthopedic Surgery at UCSF. I'm thrilled that you're interested in our program. At UCSF, we aim to train orthopedic surgeons who make a difference locally, nationally, and globally. Our program is collaborative, inclusive, and dedicated to excellence. Our department has had a long tradition of prioritizing resident education, which means a more hands-on clinical experience and learning environment. I think there are several things that make us stand out from other programs. For one, we offer a breadth and depth of training opportunities at multiple clinical sites, including global opportunities, that offers a diverse patient population and access to very different types of healthcare systems, ranging from an academic medical center to a level 1 trauma center, the VA, Shriners, even international collaborations and opportunities to train with foreign surgeons. UCSF is a leader in medical education, in research, and innovation and discovery. And as a resident, you'll have access to all those opportunities that will help you meet your full potential. It's a year-long curriculum designed to really bring everyone on the same page, to teach them the same foundational information, knowledge, and skills that are necessary to begin taking call as junior resident, that are central to their developing skills as an orthopedic surgeon. The curriculum was designed with using educational theory, learning theory, instructional design, using requirements as outlined by the ABOS and by the RRC to address some of the core surgical skills that need to be taught.
There are a large number of educational conferences that happen basically every week. The first example of that is Grand Rounds. That's when not just the residents, but the faculty are going to get together and listen to a lecture most of the time from a visiting faculty member, which is wonderful. Each one of the residents will also give Grand Rounds at one time during the residency to give them that experience. I run the summer anatomy program. Anatomy is sort of what got me into orthopedics, and it's the thing that I want to continue to try to give back educationally. So I run our 2-month-long summer curriculum every year that's lecture and also cadaveric dissection. There are 8 sessions that I've put some thought into to try to make sure that we cover all the body areas, and we cover both the anatomy, muscles, joints, ligaments, origins, insertions, and then also more specifically surgical approaches.
Within the department, we have outstanding basic and translational science researchers. We have a strong international health program. We also have straightforward clinical research projects. What makes UCSF a unique and wonderful place to do research is the collaborations. Both within the department, we have people that are specialists in essentially every subtopic of musculoskeletal health and injury and repair, but also across the university. We have the core facilities, whether it's in statistics, bioinformatics, the core facilities you would want for basic and translational research, for imaging, but the people that are involved in these cores and these research opportunities are more than willing to help and are excited to help residents, fellows, other faculty members to promote your research.
For the residents in our department, we have a 3-part DEI education program. So this involves education in allyship, microaggressions, but also in becoming upstanders and really recognizing how to identify bias when it's happening. We seek out opportunities where there are more diverse groups of medical students who are interested in orthopedics, specifically those who are underrepresented in medicine. And underrepresented in orthopedics includes not just racial and ethnic minorities, but also women. And then from a faculty and staff standpoint, I think that's also where we're able to advertise and showcase this incredible department, not just what it offers from a more traditional orthopedic standpoint and from research, but also look at the culture here. This is where you can thrive.
Being a doctor is not simply a straight shot. It's not just reading from a textbook, because there are certain unspoken things that we learn to actually become a surgeon. And so my role in the mentorship isn't simply to just teach information, but to also have a better understanding of how that information is being processed by each learner, whether or not a learner is succeeding in meeting those goals or is facing an issue. And then, as an educator, how do we as mentors bring someone up?
Because we recognize the importance of mentoring, we've also put a lot of thought in how to sort of do that in a more structured way to make sure no one gets left out. So we have these mentor colleges. So rather than assigning, a first-year resident to me and saying, okay, he's your mentor, that's your guy, so we get a group of residents together with a group of faculty just to sort of increase the possibility that you're going to click with someone and be able to get some advice from that person. And that's not just from faculty to a resident. There may be a senior resident, someone that a junior resident might really click with.
So at UCSF, we have a program called the Institute for Global Orthopedics and Traumatology, or IGOT. IGOT is our department's global outreach initiative that partners with academic centers in developing countries to support their education and training and facilitate, bidirectional exchange. So all residents at UCSF have the opportunity to go abroad for a 1-month clinical rotation. The most common sites right now where people are going are Tanzania and Ghana. And these are really wonderful experiences where you have the opportunity to travel abroad. You're working at a partnering academic center, so you're getting to work with an incredible clinical experience where you see a breadth of pathologies that you would probably never see in the United States. The resident rotation happens in the 4th year of residency, but there are these opportunities to get involved right from the beginning.
I think residency is, it's a time about finding balance, and you want to be at a place where you can use your off time to really have a good experience.
A lot of your life is going to be residency in those next 5 years, but there is a life outside of residency.
The most valuable aspects of being here have been the relationships that I've built. We have a group of residents that is a ton of fun. We all have a lot of different interests.
I learned how to surf when I moved out here, really took up the California vibe. We go skiing a couple times a year. We go hiking almost every weekend. The residents get together and do biking once a week. So there's lots of outdoor activities, which is really great.
Everyone they love to be outdoors. They love to be in the city. There's something very vibrant about being in the city, and I think that's also a big part of the program and what ties the program together.
And even when it's foggy, I get to wake up and know that I live in an amazing city with amazing people, and there's nothing that motivates me to go to work more than that.